Hello and welcome to Rajesh Television. You are watching our special show, India Fights Back, where we talk about the work done to tackle the COVID-19 pandemic. Now, today we're going to talk about the surge in cases in some states, why exactly it is happening and how we can tackle this particular challenge and what is being done on the ground in these specific states. And for more on this, we're joined by a distinguished panel of guests. Let me first introduce them to you. We have with us Dr. Samiran Panda. He is a member of NEGVAC and head of the ECD division at ICMR in New Delhi. Dr. Rajesh Kumar is also joining us. He is Executive Director, State Health System Research Center in Punjab, one of the states which has seen that spurt in cases recently. And Professor Sarman, Director of AIIMS Bhopal, is also joining us. Welcome, all of you gentlemen, to Rajya Television. Let me begin with you, Dr. Rajesh Kumar, and let's start by understanding the situation on the ground. What exactly is the situation there in Punjab specifically, since you're there, and we would like to know as to how rapidly the cases are rising and how concerned we should be.
Yeah, we are witnessing a rise in cases since last 15 days or so, and we had lowest point. We had about 150 cases. But yesterday we had about 588 cases. So there is a slow rise in cases. And this rise in cases, what we witness is in the same areas where we higher in the month of September when we had a peak. But there are one or two towns which are new, where earlier we had very low burden. But this time we are witnessing that there is a rise in those areas also. So as far as this rise is concerned, we think that this is, so far, it is not very rapid, but we are concerned that in future, if the trend continues, then we might witness some more cases, and therefore we are taking all steps right now so that this does not increase further.
Okay, and Dr. Rajesh, what is the reason behind this recent spurt in cases? Have the authorities come to a conclusion? Also, we would want to know that just like in Maharashtra, we witnessed some new strains, mutated strains which have come to light. Is this the case in Punjab as well?
See, the main reason which we think is now all the restrictions which were imposed earlier, they have gone. Now all kinds of gatherings, they are allowed, and cinemas are open, and even school, colleges, they are open. And with the decline in cases, the people had become they have come to this conclusion that the COVID is no more. So the observance of the masking, distance, and hand washing, that has gone down. So we have noticed that some of the outbreaks have happened linked to the marriages which take place indoor. Some are linked with schools, but we have had genomic analysis done initially, but that was among those who returned from abroad.
Okay.
And we did not find any strains which came from Europe or South Africa. Now we are trying to get more genomic analysis done. We are awaiting results. Okay. But we think that this is not linked with these new strains which are there in other countries.
Okay. So adherence, non-adherence to rather COVID-appropriate behavior is something which is the reason there, as we were talking about a few days ago about state of Maharashtra as well. Let me also bring in Dr. Sarman Singh here. Dr. Singh, from your point of view, sir, when we are looking at the state of Madhya Pradesh as well, there also seemingly is a bit of a concern about this rise in cases. So what's the ground situation and the reason behind that? Is it again the same rationale that people sort of let their guard down and did not adhere to the COVID appropriate behavior?
Yeah, Vishal ji, you are very right, and so was Professor Rajesh Kumar also said very rightly, because the Indians became very complacent, and they thought that corona is gone now, and that is the reason that the no physical distance and partying and roaming around, no masking, no hand sanitization. On top of that, this is also the reason that complacency is resulting into the lower vaccination in some of the states, including Madhya Pradesh, despite our trials, because people think that there is no corona and the corona is gone, so there is no need of vaccine, no need of masking, no need of all the precautions, which is probably the biggest reason that the spikes what we are seeing also in Madhya Pradesh, unlike Punjab. The another reason is that we are also having the border with Maharashtra, which is having very sharp you can see the increase. So because the border is very much porous, and people are coming and going like that, so that is also another reason. Fortunately, Madhya Pradesh has not yet seen any genetic variant so far. The strains or the samples analyzed, but actually not sufficient number of the samples has been analyzed. Now we are starting in our institute. So let us see. But the earlier we actually anticipated this long back, and in September we published one study also that mutations are going to happen, and once mutations are there, it is expected. On top of that, if you are not having proper appropriate behaviors, then this kind of spikes they were ought to be.
Okay, indeed, that is the major reason there when we're talking about the recent spurt in cases. Let me also bring in Dr. Samiran and Panda here. Dr. Panda, as we heard both Dr. Sarman Singh and Dr. Rajesh as well about these two states. The other day we were talking about Maharashtra as well, Kerala as well, and the state representatives there also pointed out that letting the guard down is the basic reason. But I'd like to start with you to try and understand the national situation here. In approximately 10 states, it is being reported that the cases are rising, and the cause of concern is the situation in Maharashtra, Kerala, and one or two more states. So what's the actual situation there in terms of the rise in cases? How fast is it happening?
Well, Vishal, the question that you have asked is very important, and you actually, while posing the question, indicated about the right approach of finding out the answer. You did talk about what is happening at the national level, so I will start my response from there. In terms of the national situation, we need to take into account the third round of serological survey that got completed in January. And what does it tell us about the national picture or the scenario or the vulnerability? 21% of the Indians are exposed and infected to SARS-CoV-2. So what is the other side of it? Immediately, the moment we say 21% are exposed and infected, 79% are unexposed and are vulnerable. So that's one situation at the population level. The second is about three different geographical settings. We have found through the National Serological Survey and also smaller scale surveys in cities that in urban slum setting, the infection prevalence is much more compared to the urban non-slum setting. And if we go farther away in the rural setting, it is farther less. So that means in rural situations or settings or in urban non-slum setting, you do have huge number of people who are unexposed and uninfected. And similarly, it immediately says that they are vulnerable. Now, why the infection is getting transmitted and we are seeing a surge? Naturally, as Professor Rajesh Kumar said and Dr. Sarman Singh indicated, that at the individual level, an infected person needs to come in close proximity to someone who is susceptible. So the National Serological Survey results that I shared clearly indicates that there is huge number of susceptible population, number one. Second, there are events such as mass gathering or even people coming together for election campaign or for any religious events. These are the situations of mass gatherings where you would expect if you infected individuals coming in close proximity with the susceptible population. So that's the second reason. The third is about misreading of the epidemic in the country. That was also indicated, but I would further elaborate. Maybe due to the messages which are going around in the print media or even in the social media, as if the epidemic is gone. COVID-19 is not there in India. So we are misreading the situation. It is not at all gone. It is very much there in India. And we are creating a conducive environment where the virus can really get transmitted from those who are infected to those who are susceptible. The last and the fourth one is about more focus on the new mutants, as if there is a new virus which is now challenging us or is staging a comeback. I would say that be it the older circulating strains or the new mutants, the chain of transmission and the way it gets transmitted remains the same. So we need to highlight this, that the virus is the same, old virus, which is using the same route of transmission. So in order to be able to prevent this surge, we have to understand that behavior change modification in a right manner and in the consistent manner would be the key.
Okay, indeed, that is a very, very important aspect. And those points there, I'd like to bring in Dr. Sarman Singh here. Dr. Singh, would you agree with that, viewpoint where Dr. Panda is pointing out that we need to go ahead and tackle both the older strain and the newer strain, and also, not misread the situation here. We will have to understand that we are still in the middle of this battle against COVID-19.
More than 100%, I would agree, because this is the truth. This is the fact, because irrespective of it is a mutant or non-mutant, it is what we call wild, the mode of transmission remains the same. So, this is respiratory. So until otherwise, you are careful that how to break the transmission, that is mass masking. We all have to have the mask. We have to have, hand sanitization properly and appropriate behavior, which most important is, crowding, avoiding the crowd and, like cinema halls and all these things. Particularly, we have seen, and the epidemiological data also shows that, in closed vicinities, this transmission is, faster as compared to the, the open areas. And that is the reason that election and all that kind of, campaigns, you can see in Delhi what is happening, pharmacy strike, but these people, they are less, they are getting less infected. And the basic reason is, if you see the virology and the epidemiology of the virus, because the dilution factor is very, very high in the open air. And so therefore, we should all avoid the close vicinity, talking, eating, that kind of things. They are more, likely to transmit the virus effectively as compared to the open air. And therefore, the vaccination has to be adopted. And now we are very happy that today the government has also allowed that, the private organizations, they also can come into play, and vaccine will be available. So definitely, this also gives an, scenario and the forecast that, now we have to again, because, what I said earlier, that people became complacent, that, as Dr. Panda also said, that, people thought that, it is gone, epidemic is gone. And we in fact, we started, celebrating that epidemic is gone. It is not till the last person in the world, because these all viruses, irrespective, because we are living in the global bliss. So even if it is anywhere in the world, not only country, and if we are traveling from one country to another, it can come again anytime. So we have to consider that, epidemic is there, virus is there, irrespective of, I am again underlining, as Dr. Panda also said, that irrespective mutant or non-mutant, we have to adopt the continuous appropriate behavior.
Okay. Dr. Rajesh, from your point of view, what exactly more needs to be done on the ground? Because Punjab is one of the states where the cases are rising again, and all these situations of, public events like marriage functions and all you were saying earlier might have resulted or ended up being a super spreader event, which resulted in the cases rising. So what more needs to be done on the ground, both by the people, the general public, and the authorities as well, so that we contain the situation and we do not lose the advantage which we now have over the virus?
Yeah, in Punjab, immediately once it was seen that cases are rising, administration has revised its policies. Now, in the gatherings, restrictions have been placed that indoor it will not be more than 100, in outdoor not more than 200. And in all the restaurants, hotels, schools, colleges, appointment of nodal officers, COVID monitors who will have a close look at, whether the COVID appropriate behavior is, practiced or not. And in most of the places like railway station, bus stops where gatherings take place, so the administration has taken a very proactive role here, and at the same time the testing has been increased in the state, whereas now it will be about 30,000 every day, so that we can detect all the new hotspots wherever it is, even in the containment zones, micro containment zone, as was done earlier, restriction of all the movements. Even deputy commissioners have been empowered that wherever they see that there is a rise in cases, they can even impose, night curfews or some further restrictions, and education of the public once more that, for observing this COVID appropriate behavior. So that is being done. But at the same time, the state is at the same time, there is a need for monitoring and for conducting surveillance for the genomic sequencing also, so that we could see which strains are circulating. Punjab is one state where mortality is higher as compared to many other states, and so therefore capacity for genomic sequencing needs to be increased in the country. Right now, there are centers who are doing it, but the need is more. It is not only for that I agree with the panelist that routes of transmission remain the same, so prevention is the same, but it has implications on vaccine, for example. So we need to monitor genomic sequencing also throughout the country and as well as in Punjab. So we are requesting that if some more centers can be set up, so that this type of surveillance can also be added, and that will help us in future.
Okay, definitely. Genomic sequencing is definitely required to understand more about the virus. The more we know about the virus, the better we'll be able to fight it. Let me bring in Dr. Panna here for concluding comments. Dr. Panna, will it be okay to say, or rather, summarize here, that we need to continue or rather have a multi-pronged strategy and multi-pronged approach here, not only putting in place restrictions as and where required, also increasing the testing facilities, the genome sequencing as well, but also a focus on the vaccination part?
Sure, Vishal, that's very important. I would sort of say that these are like our attempts to mount multi-layers of barriers against the virus. So the mask, the physical distancing during social interaction and frequent hand hygiene, and then vaccine actually add to the layers of barriers, which will attempt to break the chain of transmission. One very important point that I would like to mention, taking the advantage of this discussion, is that so the work should not only be directed towards the other prevention tools, but also addressing the vaccine hesitancy. So we need not be hesitant at all to accept the vaccine. The third most important point that I would say that we did take sera samples from the vaccine recipients, those who received Covaxin, and tried to see whether the UK variant or the variant from South Africa, they got neutralized by those serum in the laboratory. The good news is that they are working, which is a very good news. So I would say that while vaccines are going to really be of good help, great help, but we should not be hesitant. So we should say yes to the mask. We should say yes to the other COVID appropriate behaviors, but at the same time, we should say yes to vaccines as well. So the whole work now for preventing the possible second surge, as huge as first one, we do not know whether it's going to take that course. We should basically not only address the issue of COVID appropriate behavior, but also this issue of vaccine hesitancy. And in that, the active participation of the community engagement would be key or quintessential.
Okay, indeed, the community engagement is going to be really, really important there when we're talking about both aspects, vaccination as well as taking those steps to contain the virus, be it the original strain or the modified strain there. Thank you so much, Dr. Samiran Panda, Dr. Sarman Singh, as well as Professor Rajesh there for sharing your views with us and our viewers. And as our panelists were pointing out, it is really, really important for all of us to understand the basic fact, and that is that the virus, the COVID-19 virus, has not gone away. It is still amongst us. We are still fighting that battle against the COVID-19 pandemic, and we cannot let our guard down in terms of ensuring that we adhere to the COVID-appropriate behavior. And this particular COVID-appropriate behavior, as we've always been telling you, I would once again reiterate, is just a simple three-step process. Starts with wearing a mask, as our panelists were also pointing out. Ensure that you wear your mask at all times. Also, please ensure that you wash your hands regularly. Hand hygiene is very, very important. And also, maintaining physical distancing when you are in public spaces is equally important. So these three simple steps of COVID-appropriate behavior will go a long way in keeping you and your near and dear ones safe and healthy. We'll come back again tomorrow with a different topic. Till then, keep watching Rajya Sabha Television.